Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
This deep dive was created using generative AI tools to support accessibility and clarity. The content is grounded in the research and instructional work of Dr. Michael Jones. Welcome to the deep dive. Okay, imagine this scenario. You've got a dedicated mental health provider, totally committed to client privacy, right? And then suddenly they find themselves tangled up in like a HIPAA nightmare. Not because they were careless, but because one tiny detail, something in their tech setup, was missed.
That happens more often than you'd think.
Exactly. So today, we're diving deep into preventing precisely that. We're aiming to give you, our listener, the ultimate playbook, really, for ironclad client data protection in this digital age. Our mission, it's pretty simple, actually. We want to equip you with a kind of shortcut, a way to get quickly up to speed and be truly well-informed on navigating this complex world of business associate agreements and, robust PHI controls.
It sounds technical, maybe a bit daunting even. It really can, but we promise clarity. We got some surprising facts lined up and definitely some actionable takeaways, things you can actually use to make a difference in your practice. Okay, let's try and unpack this landscape then. Integrating technology into mental health, it offers just incredible opportunities, doesn't it?
Oh, absolutely. Game-changing in many ways.
But with that power comes significant responsibility. And right at the heart of it all is protected health information, or PHI.
Yeah, and it's crucial to understand just how broad PHI really is. We're talking about any individually identifiable health information. Doesn't matter if it's spoken, written down, or electronic. If it's held by a covered entity or, importantly, a business associate.
So it's not just notes or diagnoses.
Not at all. And then there's ePHI, electronic protected health information. That's simply the PHI that's created, stored, transmitted, or received electronically. So think about it. When you shift from maybe a paper file to a video call, you're not just changing the medium.
You're stepping onto this digital frontier. And on that frontier, cybersecurity isn't just, a nice to have. It's the absolute foundation for client trust and keeping that data secure.
So this digital frontier, what does this really mean day to day for mental health providers trying to stay compliant, stay ethical?
Well, this is exactly where business associate agreements, or BAAs, come in. They are the absolute cornerstone of HIPAA compliance. Really foundational.
The BAs.
A BAA isn't just like a formality. It's a legally binding contract. It's made between a HIPAA PECA-covered entity that's usually you, the provider, or maybe a health plan, or even a clearinghouse handling electronic health info, and a business associate.
And the business associate is...
Right. So a business associate is basically any person or organization performing services for you, the covered entity, where they might encounter PHI doing that job. Think IT support, billing services, maybe even email providers. This agreement, this BAA, it creates this really essential web of shared responsibility.
Shared responsibility.
Yeah.
Okay.
And here's where things got, significantly more serious. The HITECH Act. Before HITECH, business associates were sort of less directly accountable under HIPAA. They handled your data, sure, but the covered entity held most of the direct liability. This HITECH changed that completely. It made business associates directly liable for violations, and it ramped up the penalties significantly. This really shifts the dynamic for providers like you.
How so?
Because while they are now directly on the hook, your responsibility to choose them carefully, to vet them, is amplified. Because if they slip up, it can still create major problems for your practice. Their compliance is linked to yours.
Wow. Okay. So it's not just about my actions, but who I choose to partner with. I have to admit, when I first started looking into this, I was genuinely surprised by how many different relationships actually need a BAA. It's way more than just the video platform, isn't it?
Oh, absolutely. It's easy to underestimate. Technology providers are the obvious ones, right? Video platforms, EHR systems, email services if they handle client communication, cloud storage, practice management software, billing services.
That's already quite a list.
It is. But then you have professional services, too. Think about IT support companies who need access to your systems, transcription services, legal consultants, maybe reviewing client files, Accounting firms, if they handle practice finances that include client data, even sometimes marketing companies say, if they access client testimonials. If PHI is involved in their service to you, you likely need a BAA.
Okay, that widens the net considerably.
It does. But it's also helpful to know what generally doesn't need a BAA. For instance, referring a client to another treatment provider. That usually falls under treatment exceptions. You're collaborating on care, not outsourcing a function involving PHI in that specific BAA sense.
Got it.
Your direct employees, the ones working on site, they're part of your workforce, not separate business associates. And services that have absolutely no access to PHI, like maybe basic website hosting that doesn't collect any client information, they typically don't require one either.
So the key question is always,
does this third party touch PHI while providing their service to me? That's the fundamental question.
that really clarifies things. Okay, so let's say you've identified, yes, a BAA is needed. What are the absolute non-negotiables? When you're looking at that contract, what has to be in there to really protect PHI properly?
Well, HHS, the Department of Health and Human Services, they outline specific mandatory elements. These are essentially your guardrails for client data. First, you need really clear permitted uses and disclosures, meaning the BAA has to spell out exactly how the business associate can use the PHI. Which is almost always limited to things like treatment, payment, or healthcare operations. And it must strictly prohibit any use or disclosure that goes beyond those terms. If it's not written down as permitted, it's forbidden. Simple as that. Second, safeguard requirements. This is critical. The BAA must demand appropriate safeguards to prevent unauthorized use or disclosure. This explicitly includes implementing the HIPAA security rule requirements for electronic PHI, the ePHI we talked about.
Like encryption.
Exactly. It means mandating current, strong encryption standards. Think end-to-end encryption for data, both when it's moving and when it's stored. Third, breach notification procedures. This is non-negotiable.
What does that involve?
The BAA has to require the business associate to report any unauthorized use or disclosure, any breach, basically.
Okay.
And crucially, it should set specific, clear timelines for when they have to tell you. You need to know fast if something's gone wrong. Fourth, subcontractor requirements. This is about that chain of trust.
If they hire someone else.
Precisely. The BAA needs to ensure that any subcontractors the business associate uses are held to similar privacy and security rules. Your BA has to have BAAs with their subcontractors who handled your PHI. Finally, termination provisions.
What happens when the contract ends?
Exactly. The BAA must specify what happens to the PHI then. Usually, the options are for the business associate to return all the PHI or securely destroy all copies. They might retain some only if it's absolutely necessary for, say, legal or administrative reasons, but that needs to be clearly defined and limited.
Okay, so we've got the legal framework sorted with the BAA, but, contracts are one thing. What about the ethical side? Our core professional duties. And beyond the paperwork, what are the practical, technical steps we need to take to secure data in our Chase Tech practices?
That's a great point, because the ethical codes really guide us here. The ACA Code of Ethics, for instance, Section H.2b, explicitly acknowledges that maintaining confidentiality with electronic records has limitations.
Right, it's not foolproof.
It's not. And H2C stresses that we must inform clients about these limits when using technology. Then H2D gets very specific. It requires counselors to use current encryption standards and take reasonable precautions for electronic communications.
So the ACA is pretty clear on encryption.
Very clear. And the MBCC Code of Ethics, even more direct in some ways. Standard 94 mandates that all electronic tech communications with clients must be encrypted and secure.
All of them?
All of them.
Oh.
Standard 97 requires providing written info to clients about protecting their records, passwords, electronic communications. And Standard 98 says you have to inform clients of potential risks, like using public Wi-Fi or shared computers. These aren't just best practices, they're ethical obligations.
Okay, so ethics points strongly towards tech safeguards. What does that look like practically?
For telemental health, let's take video conferencing. You absolutely must ensure the platform meets tough security requirements. End-to-end encryption for the video itself is essential. Look for things like private cloud options, maybe with automatic deletion of any temporary content.
Features like waiting rooms.
Yes, password controls, waiting rooms, those add layers of security. The platform must sign a BAA with you. And their policies need to guarantee that no content is stored on third-party servers without your explicit agreement via that BAA.
And email.
Same level of diligence. You need end-to-end encryption for messages both in transit and when stored. Strong access controls who can see what. Does it integrate okay with your other systems? Is there professional customer support if something goes wrong?
What about phones? Texting clients?
Mobile devices need attention too. Think about notification settings. You don't want sensitive info popping up on a locked screen. Maybe just settings to de-identify notifications. Consider phones that offer end-to-end encryption for text by default, or better yet, use dedicated secure messaging apps like Signal, especially if native encryption isn't guaranteed. It's really about a holistic HIPAA text security posture.
That is a lot to juggle. It sounds like there are many places, many nuances where providers could potentially stumble. Where do people often run into predictable traps with compliance? What are the common missteps you see?
Yeah, there are definitely common pitfalls. Knowing them is, like you said, a shortcut, one of the biggest. Just relying on a vendor's claim that they are HIPAA compliant.
That label seems everywhere.
It is, but here's the catch. That phrase isn't regulated or certified by HHS. It's often just a marketing term. You absolutely cannot take it at face value. The real shortcut here. Demand specific technical documentation. Ask them how they encrypt, what their security protocols are. Get the details.
Don't trust, verify.
Exactly. Another major vulnerability is inadequate client education. Providers really need to discuss information security directly with clients, not just once at intake, but revisit it periodically.
And document that conversation.
Absolutely. Document that they understand the risks associated with technology, provide clear written information about your security measures, and, just as importantly, the potential risks they face, like using unsecured networks. That client understanding is vital for ethics and compliance.
Okay. So if we want to be systematic, step back before choosing a platform or service, what's the recommended strategy before signing on the dotted line?
Due diligence is key before you sign anything. First, confirm their status. Are they actually a business associate for you? Will they handle, store, or transmit PHI on your behalf?
Step 1, confirm they need a BAA.
Right. Second, request the full BAA documentation. Don't settle for a promise or a link to generic terms. Get the actual agreement. Third, review their technical specs yourself. Do they actually meet the encryption standards and security measures you need?
Don't just rely on the BAA language.
The BAA might say they'll use appropriate safeguards, but you need to know what those are. Fourth, and this is really important, always have an attorney review the BAA before you sign it, especially if it's not your own standard BAA. And finally, document your own risk assessment. Show you've evaluated potential vulnerabilities and planned how to mitigate them. And when you're reviewing that contract, look for specifics. Verify they use current standard encryption. AES 256 is generally the minimum baseline you want to see. Get clear info on where your PHI will be stored and processed. Is it staying within the country, for instance?
Good point.
Confirm they use multi-factor authentication, MFA. That adds a crucial layer of security. Check for role-based access controls so only authorized people can access specific data. Ask for evidence of regular security assessments or audits, and insist on crystal clear procedures for breach notification. If these elements are weak or missing, that's a huge red flag.
It really sounds like compliance isn't a one-time setup. It's not just getting the BAA signed and picking a platform. What does that ongoing attention look like?
You're absolutely right. Connecting this to the bigger picture, compliance is definitely an ongoing process. It's not a destination you arrive at. It means things like annual BAA reviews. Are the agreements still current? Have services changed? Have regulations changed?
Need them updated.
Exactly. Regular staff training is vital. Everyone on your team needs to understand PHI protection and the tech policies. Keep communicating with clients too. Periodic updates on security measures, reminders about risks, and documentation is key. Keep diligent records of all your BAAs, your risk assessments, your training logs.
It seems like a lot of administrative work.
It can be, but it's essential. And interestingly, this aligns directly with the KCREP 2024 standards, particularly standard 2.F.1 meter, which specifically emphasizes understanding technology's impact on the counseling process. So it's part of our core professional standards now. And we need to talk about the stakes. The financial reality of noncompliance is, well, significant, and it's increasing. Covered entities can be fined just for not having BAs in place or for having incomplete ones, even if no actual breach occurs.
Really? Just for the paperwork being wrong?
Yes.
Yeah.
Recent enforcement actions show the Office for Civil Rights, OCR, is really focusing on BAA compliance during investigations.
Yeah.
Penalties can range from $100 up to $50,000 per violation. The maximum annual penalties can hit $1.5 million. And in cases of willful neglect, criminal charges are possible. These aren't just theoretical threats. OCR is actively enforcing this.
Wow. That That sounds incredibly burdensome, particularly for smaller practices or solo practitioners with limited resources. It almost makes you think twice about using tech, doesn't it? But seriously, that's a very real worry for many listening. Are there practical, budget-friendly options out there?
That's a totally valid concern. It is a challenge. But the good news is, yes, there are budget-friendly HIPAA-compliant options available across different service types. For email, for example, you've got Google Workspace for healthcare. It's often around $5 to $10 per user per month, and they offer a BAA. Microsoft 365 for healthcare is another option. Pricing varies, but again includes a BAA. Hushmail for healthcare is specifically designed for this, typically around $9 to $19 a month.
So secure email doesn't have to cost a fortune. What about video?
For video conferencing, Doxy.me actually offers a free basic plan that includes a BAA. That's a great starting point for many. Simple Practice Telehealth is integrated into their system, which is convenient. Zoom for healthcare is another standard, around $240 per year per license, roughly.
And practice management systems.
Lots of options there, too, with BAAs. Therapy Notes is often around $59 a month. Simple Practice ranges from about $39 to $99 monthly. Theranos is typically $39 to $69 a month.
Look.
So yes, robust compliance is achievable without necessarily breaking the bank. You just need to shop smart and ask the right questions. But even with affordable options, you have to be vigilant about red flags during contract evaluation. Things providers should just refuse, period. If a vendor claims HIPAA compliance but won't give you technical documentation, walk away.
Big red flag.
Huge. Refusal to specify their encryption standards. Red flag. Broad liability waivers trying to excuse them from responsibility if there's a breach. Absolutely not. Lack of clear breach notification procedures. Deal breaker. If they don't address their own subcontractor relationships, problematic. Or if they claim unlimited rights to retain your data forever without justification, no way. Your practice integrity is on the line.
It is so clear that understanding all these details isn't just ticking a compliance box. It feels absolutely fundamental to ethical practice for every single mental health professional, whether you're just starting out or you've been doing this for years.
It really is woven into the fabric of our professional standards now. As we mentioned, it hits KCREP 2024 Standard 2 by F.1 directly understanding tech's impact. It supports those ACA standards, HJudge 2B, C, and D, on tech and confidentiality. And it directly addresses NBCC standards 94, 97, and 98 about electronic communications and client protection. It's not just an IT thing anymore. It's a core competency for practicing ethically and effectively today.
Well, this has been a fantastic deep dive, really navigating the complex but totally vital world of business associate agreements and PHI controls and telemental health. I think the core message really is finding that balance, isn't it? Leveraging all the amazing innovation technology offers while holding firm on that unwavering commitment to protecting our clients. It takes understanding the legal bits, yes, but also that careful, continuous vendor evaluation and just keeping an eye on how standards evolve.
Exactly. And providers who approach this systematically, proactively, they really can leverage technology's benefits. They can expand access, offer convenience, and do it all while upholding the trust and confidentiality that is, at the end of the day, the bedrock of the therapeutic relationship. That's the goal: secure, ethical, effective care in the modern age.
As you think about today's topic, consider these questions. 1. How might the principles of business associate agreements and PHI controls discussed today specifically inform your current decision-making when selecting or evaluating technology for your professional practice? 2. Considering the emphasis on client education regarding technology risks, what specific strategies could you implement or enhance to ensure your clients fully understand the limits and protections of their electronic health information? Thank you so much for joining us for this deep dive. We really hope this has given you that shortcut to being well-informed, and we encourage you to continue exploring these really critical topics in your own practice.